One of the most painful things is for a woman to be feeling her baby move in the morning, and in the afternoon, she cannot feel that baby move again. She goes for a scan and then they tell her that that baby is no more alive. That thing is painful, unexplained, no sign, no symptom, nothing. And that's it. In this video, I want to explain one of the commonest causes of this, and it's highly underrated. People don't even check for it during their antenatal. They check for other things, give you those drugs, give you the injections, but many places don't check for it because many places don't even have the ability to do it. But it's very easy. If they don't have the ability to do it, they can send you to a place to do it. And that is high blood sugar in pregnancy. It's called gestational diabetes. Gestational diabetes is one of the commonest causes of unexplained baby death while they are in the womb. And it's very easy to diagnose. There are certain number of women that easily prone to this gestational diabetes, which is quite common. So if you are among this category of women, please, when your pregnancy gets to 7 months, that's 28 weeks, some will even have to do it earlier. You have to mention it if they don't mention it to you, because you need to save yourself and your baby. Number one, if you're currently pregnant and in your previous pregnancy, unfortunately, you lost the baby. So you have a previous baby loss. Number two, you're currently pregnant and you are more than the age of 40 years. Number three, you're currently pregnant, but in your previous pregnancy, you gave birth to a very big baby. That baby was more than 4.5 kilograms. So a previous big baby. That's a sign that in this pregnancy, we need to monitor you closely. Number four, you have a relative that has high blood sugar. The next category are women that are on the big side. And then for some of you, you go for antenatal. They take that urine that they normally use to, do a quick check, and they tell you they see sugar in it. Some of you, they do that test. You don't even ask them what the result is. You need to ask. If at all they detect any glucose, any sugar in your urine, then you need to do this test. The next category of women are women that, for some reason, they don't understand. They are pregnant and they are just urinating so frequently. They are eating more than they usually would, and they are drinking so much water. So they have these symptoms all of a sudden coming from nowhere. Then we need to check for this. Or you are pregnant, they go for scan, they monitor the water around the baby. The baby has some fluid, we call it amniotic fluid around the sac, and that fluid level is very high. Then you need to do this test. So the name of this test is called oral glucose tolerance test, OGTT. It's not the normal blood sugar test where they just prick your fingers, they say this is your fasting blood sugar run. No, this is specially done in pregnancy. The other ones are not so effective in pregnancy. This one is able to detect if your blood sugar levels has gone up in pregnancy, because pregnancy, unfortunately, because of some hormones in the placenta, it can make your blood sugar levels to begin to go up. And some women, after they give birth, it will refuse to go down. About 50% of women, it goes down. So this is very important, because if we detect it early, we can treat it. Many women don't even need medications. We can treat it with diet. Some can use tablets, and then very few women will need to use some injections. And then time your delivery, because the time to deliver for a woman that has high blood sugar in pregnancy is different from the time to deliver for a woman that does not have it. There is a time that we know that the danger can strike. So what we now do is that we will deliver the baby before that time. Please, this information is very important. If you are among the category of women I've listed, it's very important that when you get to 7 months, speak to your healthcare provider, the person doing your antenatal, that do I qualify for the blood sugar test, OGTT. That might just be the lifesaver of that child.